30 years old.
Yes, doctor.
Mrs. Mona, today we are here to discuss about your health condition and I'll be happy to examine you and address your concern. Is it okay for you?
Yes.
It came to my knowledge that you have some weight loss. Can you tell me more about it?
Yes, I have now 20 kilogram loss in a year. And this is actually not intentional at all.
I'm very sorry to hear this, Mrs. Mona. It must be concerning for you. I'll try
Yes.
to help you sort it out. So, is it, you said it's not intentional. Did you change maybe the diet or exercise?
This last year, I didn't change the diet or exercise. And I'm trying my best to gain some weight, but I couldn't do it.
I'm very sorry. And the things is increasing by time?
Yes. I'm getting
And with this,
skinnier and skinnier, yes.
very sorry, with this weight loss, do you feel fatigue?
Yes, very fatigued.
Do you look pale?
Yes, many commented yes.
Sorry, do you have high body temperature?
No, no, I don't have high body temperature.
Any lumps and bumps?
No,
Any neck swelling?
no.
Any weather preferences?
Yes, yes. I prefer hot weather. I get cold very easily.
This is since how long?
This is since the last 1 year also, doctor.
Okay, any dizziness on a standing position?
Yes, all the time.
Any joint pain?
No joint pain.
Any skin changes?
My skin is dry.
I'm very sorry for this. And any back pain?
I have some back pain, all over body aches, doctor.
And Mrs. Mona, I want to ask you, with this feeling tired, fatigue, do you have awareness of your heartbeat?
Yes.
Since how long?
This is for the past maybe 1 year.
Hmm. Okay, is it like with activity or at rest?
No, this is at rest. I feel that my pulse is becoming more of slow.
And when you do activity, it's more fast?
Sometimes make me more aware of my heartbeat.
Any chest tightness?
No, no,
Any chest pain?
no,
Breathing discomfort?
no,
Cough?
no cough.
Did you ever collapse?
Collapse? Yes, one time. This 1 month ago.
What happened exactly?
I have very low blood pressure and blood sugar that time.
Okay, is your how much your blood sugar was?
It was about 55, and my blood pressure was 90 over 60. They give me some sugary material and in the ER, and some through vein, some saline or something.
Is your skin color became more dark than usual?
No, no.
Okay, right. And do you have a partner?
Yes, I'm married.
How is your monthly cycle? Is it regular?
No, no. I don't have my monthly cycle now for 6 months.
Okay. May I ask any chance that you're pregnant?
I'm not pregnant.
Okay. Do you use any birth control pills?
No.
Any recent delivery?
Yes, my last son was 4 years ago, and it was okay then.
The delivery was eventful.
No, no.
You were able to lactate him, to
Yes,
feed.
yes, yes.
Any problem in your intimate relationship?
I don't have intimate relationship, doctor. Yes, I have decreased desire recently.
I'm very sorry for this. And any miscarriages?
No,
How is your mood overall, Mrs. Mona?
my mood is not okay, doctor. I feel down all the time. I don't like my shape anywhere.
May I ask you, do you think your life is still worth living?
No, It's becoming more distressful nowadays because I don't like my image, and my husband also is distressing me about it.
I'm very sorry for this, Mrs. Mona. Mrs. Mona, do you have any excess body hair in your body?
No, no.
You don't have. Okay. Miss Mona, do you have any tummy pain,
Tummy pain? No.
tummy swelling,
No.
feeling sick,
No.
throwing up,
No.
any alteration of your bowel habit?
Yes. I have hard motions most of the time.
Okay. And this is since how long?
This is for the last 6 months also.
Okay. Is there is any pain while passing the motion?
No, no, no pain, but hard.
And any water work change?
Yes, my water work is excessive.
Excessive in what term you mean? Like the
Uh,
frequency or the
yes,
amount?
large amount.
Large amount. And how you compensate this? Do you drink a lot of water?
I try my best to keep myself healthy and drinking lots of water, but it is not seeming that it helps.
So you feel thirsty all the time?
Yes.
Okay, right. Okay. And the color of the urine is disturbed?
No, no, the color is okay.
Color is okay. Okay. And there is no pain. Did you ever pass gravels?
No, no.
Okay. Right. Mrs. Mona, may I ask you, did you ever diagnose with any health condition?
No.
Do you take any medication?
After my last delivery 4 years ago, I gained a lot of weight. So I started to take some herbals regarding the weight loss. At first, it helps, but I'm taking it regularly now, and I'm continuing losing weight. I can't
So till
tolerate
now,
food anymore.
taking it?
No, no, I stopped taking it 1 year ago, but my weight is keeping. I'm keeping losing weight.
May I ask what is the name of this?
It is some herbals, doctor.
Any over-counter medication?
Yes, this was over counter.
Any illicit drugs?
Illicit drugs? No.
Any history of hospitalization before?
Yes, the time I collapsed.
They give you any diagnosis?
No, just low blood sugar, low blood pressure that time.
Any blood transfusion?
No,
Sharing needles?
no,
Tattooing?
no,
Did you travel recently?
no.
What do you do for living?
I'm a housewife.
Okay, how the things affecting you? I can see it's affecting you very badly.
Yes, yes, yes. I can't tolerate any effort anymore.
Can I examine you?
Yes,
Meanwhile, I might need to ask more question. Okay.
yes, please.
I need to
Yes,
know
please.
signs of the patient.
Okay. Blood pressure of the patient is 100 over 60. Heart rate is 80 beats per minute. Temperature is 37. What do you want
Mm.
else?
I want to examine the pulse. If the pulse is regular.
Yes, the pulse is regular.
Okay. Okay. Blood pressure standing position.
Yes, there is posture hypotension.
And what about the pulse on standing? Does it increase?
No.
Is the patient looks pale?
Yes, she's looking pale and sunken eye.
Is the patient has prolonged capillary refill?
Yes.
Is the patient is dehydrated?
There is some signs of dehydration like delayed skin turgor.
Okay. Is there any neck swelling? I need to examine for thyroid.
Examine doctor. No neck
Okay, I
swelling
will.
could be appreciated.
Okay, no neck swelling could be appreciated. Okay. And I need to examine the patient abdomen. Any in tenderness?
No tenderness.
Any organomegaly?
No.
Okay, then I will examine the patient heart. Any abnormal sound?
No, no.
Mona, I need to ask you, when you see yourself in the mirror before when you were gaining weight, did you feel that you're not satisfied with your weight?
Yes. It was bothering me so much, doctor.
And do you still see yourself overweight, or what do you see?
Yes, I like more to be fit and thin, but now what's concerning me more is my health, doctor. Now I'm trying to take and increase my oral intake, but unfortunately, this is not helping anymore, and I can't tolerate even food.
You mean that you're trying to eat, but you cannot eat.
Yes,
So the amount of the food is very less.
yes.
Hmm. Okay, Mrs. Mona. Okay, may I ask you what is your concern?
My concern about this weight loss, doctor, could be something I can fix. Can I regain my weight again?
Hmm. Your concern is very valid, Mrs. Mona. I think after I spoke to you and evaluating you, that you have a condition which we call in medicine anorexia nervosa. It is simply when you are seeing yourself in a different way than the normal, like seeing yourself very obese or very big, uh, in the fact that you're not. Oh, you got my point? So,
Yes.
and with this will make you go to into this vicious cycle of you don't want to eat and losing weight. And this lose weight, it makes you more weaker, and it disturb your cycle, disturb your intimate relationship as well. And I can see how you are very disturbed about what's happening and your mood is not okay. So what do you think?
Okay, doctor. Can I help regarding this? Is this herbals still affecting me?
I think this is one of the triggers in your condition. However, we need to admit you, and we need to make a team of doctors from the mood doctor, very important, dietitian, and gland doctor. And we need to run some tests for you, very important, and give you some fluid. And we will come back to you with the result. Do you have any other concern?
No, doctor. Thank you.
Thank you very much.
Okay.
Mm.
Now discussion with the examiner. Present your positive finding, please.
This is Mona, 30 years old, who presented with weight loss and background of being obese before, and she lost used some herbal. She is disturbed, mood disturbed, too much disturbed, and I think she's having some suicidal risk. She's having dizziness on standing position. She is having cold intolerance. She looks pale on examination. I need to know body mass index of the patient. Patient blood pressure is 100/60 with no variation on standing, as well as the pulse. Pallor is there. I couldn't appreciate anything else by examination.
Okay.
So
What's your
I
diagnosis
think
and
she,
differential?
in this young age, with somebody with mood disturbance and was taking medication to lose weight, it can be anorexia nervosa.
Okay.
It's very important to rule out any endocrinal issue like thyroid.
Okay.
Very important to rule out malignancy in this condition.
Okay. What other differential diagnosis you need to rule out?
We need to rule out infection. Uh, um, uh, we need to rule out
You
also
mentioned about endocrine disorder. Other than thyroid, which type of thyroid disease you expect?
hyperthyroid
Uh,
can give this sort of weight loss, but
Okay.
again, is this patient does not have hot intolerance. She's having cold intolerance,
Okay.
and can be also she was like hypothyroid. Then she started to be hyper. However, it's not very common.
Okay. What other
Um,
than the thyroid disease you need to exclude in this patient?
can be pheochromocytoma.
Okay.
One of the reasons give the weight loss also. But again, is this patient doesn't have high blood pressure.
Okay. What else?
Can be patient also have some symptoms of hypercalcemia, drinking a lot of water and passing a lot of urine with hard motion.
Okay. Could
So
could the herbals the patient is taking could result in a large amount of water work and being thirsty and also weight loss and low blood
yeah,
pressure?
it can be nephrogenic diabetes insipidus.
Could the patient is taking diuretics to lose weight?
She didn't mention in the medication.
She mentioned about herbals, but she is not aware about the content. So if sometimes the herbals may contain some laxative and some diuretics, which will result in dehydration and at first water work. There will be polyuria, but after that the patient will develop AKI and constipation more. Okay,
Mm,
could be something
mhm.
related to any other endocrinal disorders.
Can be diabetes. It's very important
What
to rule
about
it
the
out in this.
amenorrhea? Could be related to anything else?
Patient can be pregnant. Patient can be having hyperthyroid, can give amenorrhea. PCOS, however,
Could be
patient doesn't
something
have
related to the
symptoms.
pituitary gland, maybe?
Um, but again, this patient doesn't have ممكن.
Continue, doctor.
Uh,
Maybe Addison disease, maybe panhypopituitarism, maybe premature ovarian failure. These are also need to be excluded. Yes?
mm,
Okay. How would you like
نسيت
to
أسأل.
manage this patient?
This patient need urgent admission as she's at risk of dehydration.
Hmm.
Risk of suicidal is there.
Hmm.
We need to make multidisciplinary team from endocrinologist and psychiatrist and nephrologist also, as well as cardiologist. And we need to run some blood test, full blood count, blood sugar, kidney function test, renal function test, liver function test, electrolytes. We need to start IV fluid also for her, and we need to screen her for the cause. We need to do thyroid function test. We need to do pregnancy test. We need also to screen her against other possible endocrine disease,
Okay.
like for
How would
fake.
you like to start the treatment of this patient other than fluids?
We need to start nutrition for her by consulting the nutritionist, as this patient at risk of what we call إيه؟ feeding early feeding
Refeeding syndrome. At risk of refeeding syndrome. How would you like to start management a patient with risk of refeeding syndrome?
um, I'm not sure.
Okay, so you need to start this patient, start the feeding slowly, the nutritional support, maybe starting by half the dose of her nutritional requirement. You need at first to start screen about electrolyte imbalance like potassium and phosphorus, and to replace thiamine B1 before starting the carbohydrate intake, because starting large amount of carbohydrate at once may give this patient make this patient at risk of hypokalemia, hypophosphatemia, which may result in fatal arrhythmias up to death. So this could be
Mhm,
taken seriously.
mhm.
Okay. Other than management of dehydration and refeeding syndrome, anything else you want to help?
She need anti depressant medication.
Okay. Okay. Other than antidepressant, anything else the psychiatrist can help?
Psychotherapy.
CBT, cognitive behavioral therapy.
Yeah, yeah. Mhm.
Cognitive behavioral therapy. Okay. In the lab of this patient, what do you expect?
Hypokalemia,
Okay.
hypophosphatemia,
Okay.
um, maybe hyponatremia also
Okay.
because of electrolyte imbalance.
Okay.
Um, high creatinine, maybe kidney injury.
Okay.
Uh,
Okay.
hypoglycemia.
What do you expect about the glucose and lipid profile of this patient?
What do you expect in the glucose and lipid profile? I think lipid profile will be high.
Yes.
because she's in a catabolic state. What about the glucose here?
It will be low.
What?
It will be low.
Maybe it would be low. Maybe she will have impaired glucose tolerance also because of the catabolic mechanism. What about the electrolyte? What do you expect? The hormonal profile of this patient. What do you expect?
I expect low FSH and LH.
Yes.
I expect uh, بس هو FSH
You
وال
ex-
H.
you you will expect about the amenorrhea. You will expect low estrogen, low low FSH, low LH, and high cortisol and growth hormone because these are anti-insulin hormone, and these hormones released in starvation state.
الجروث هرمون والكورتيزول.
Yes, 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 yes. Okay, thank you, doctor.